and cephalosporin is beta-lactam antibiotic. Then the first obtained from the fungus Cephalosporium acronomium. It is the first fungus from which cephalosporin is obtained. Then now we are discuss about some chemistry about cephalosporin. It contain beta-lactam ring, then add with a dihydrothiazine ring, as you see on screen. That is the dihydrothiazine ring, and it is fused with each other. Beta-lactam and dihydrothiazine is form Cepham nucleus. It is known as Cepham nucleus, and 7 position is alkyl amine group, that is known as 7-amino cephalosporic acid. Total substance molecule is known as 7-amino cephalosporic acid. Okay. Then we are go through mechanism of action. Same to as penicillin. All beta-lactam antibiotic is the same mechanism of action. That is the main function is bacterial cell wall degradation. And how bacterial cell wall is composition is composed NAM and NAG unit. NAM means N-acetyl muramic acid, NAG means N-acetyl glucosamine. In NAM unit, that is 5 number of alanine, D-alanine amino acid chain, and in 3 position, as you see, 5 pentaglycine, 5 number of glycine is attached. As this next phase of NAM and NAG is similar to this pattern, and this pentaglycine, as you see in screen, is attached with the 4 number of adjacent NAM unit, adjacent NAM unit, 4 number of D-alanine. How? Now one enzyme is transpeptidase. It is help to the hydrolysis of 5 number of alanine, D-alanine. Then it is attached to the pentaglycine. 5 number D-alanine is hydrolysis, and one OH group, that is OH group which mutually connected with each other, and it is form a form a bond, and this bond is make the bacterial cell rigid. That is known as cross linking. This transpeptidase enzyme, and this transpeptidase enzyme is formed a penicillin binding protein. That penicillin binding protein have tendency to bind beta-lactam antibiotic, and cephalosporin antibiotic, some drug are cefazolin, and it is administered in intramuscular and intravenous. Cefoxitin IM and IV can be given. Cefotitan only intramuscularly given. Cefixime, popular drug, it is given in orally. Cefoperazone, it is given in intramuscular and IV route. Cefepime only given in IV route. This drug, what will done? It inhibit cross-linking. That cross-linking in NAM and adjacent NAM group by the help of pentaglycine. It cross-linking is inhibited and no cell wall synthesis occur. If the bacterial cell wall synthesis is not done, then the bacterial cell component is ruptured. A bacterial cell wall is ruptured and the component is expelled out, and ultimately the bacterial death is occur. If bacterial death is occur, then the action is bactericidal effect or bactericidal action. And then we are go through some pharmacokinetic effect of cephalosporin. Then it is given in orally, parenterally, as you see the previous Then excreted mainly unchanged by kidney. It is an active metabolite is excreted by kidney, except cephalosporin is excreted by bile. In only cephalosporin is excreted through bile acid through feces. Then one drug is probenaic acid. If given with any beta lactam antibody, any beta lactam antibiotic is given with probenaic acid, then it extend the T half of penicillin because it block probenaic acid is block active tubular secretion. So the longer duration of action of penicillin is so. Penicillin is secreted by kidney or the functional unit of kidney nephron through active tubular secretion, so that it short duration of action. Then if you is given with the probenaic acid, then it block this active tubular secretion and ultimately changes the duration of action of penicillin. Then ADR, adverse reaction. What is this? First, hypersensitivity reaction occurs. In hypersensitivity reaction, skin rashes, urticaria. Urticaria means the dermatitis or any dermatological problem is occur through the medicine, pollen grain, food. That is the urticaria. Rarely anaphylaxis. Anaphylaxis is a medical emergency in which hypertension crisis occur, any type of medical emergency that is not survival by normal people. Then gastrointestinal disturbances. What is this? Diarrhea, cough, vomiting, anorexia, eating disorder. Do not take food by the patient in this anorexia condition. And the nephrotoxicity occur, toxicity in nephron, so the kidney failure is occurs. And thrombophlebitis occurs. Thrombophlebitis is a condition, clot formation in vein, which causes inflammation and severe pain. Occasionally you see the legs legs of the body part is swelling and redness, seen in redness. That is the thrombophlebitis. And next is intolerance to alcohol. It is shown disulfiram like reaction. Disulfiram is a drug which inhibit aldehyde dehydrogenase, and this aldehyde dehydrogenase is help in alcohol metabolism. That is the main part of alcohol metabolism. If it is inhibited, then alcohol get toxicity. And so the convulsion, headache, vertigo, vomiting, that like reaction is seen in patient. Then we have to see therapeutic uses. Therapeutic uses of cephalosporin, most popularly used community acquired pneumonia. That is the drug of choice is ceftriaxone and cefotaxime. And pyelonephritis means kidney infection, that is known as kidney infection or inflammation in nephron. The drug of choice is ceftriaxone. And gonorrhea means that is the sexually transmitted disease which is very painful and untreated sexually transmitted disease is known as gonorrhea. That is most very dangerous situation. And the drug of choice is ceftriaxone, the drug of choice. And typhoid fever, the drug of choice is ceftriaxone and cefoperazone. Then meningitis means the meningin, in the brain, um, the durameter and pyometer and arachoid is known as meningin. The skull and brain gap is known as meningin. In the meningin is inflammation occurs, that is known as meningitis, and the drug of choice is cefotaxime. It is the all over a brief description about cephalosporin. And have you any doubt, please comment. Thank you so much.